What is a senior discount plan, and is this something I need? Or, why did I get this? And how much is it going to cost me? What's the catch? Well, I get calls about this all the time, and lately it seems like some of the insurance carriers, the Medicare insurance carriers, are sending things out and didn't bother to tell me about it. And so I'm getting calls from clients and even people who are not clients, but they may be going on Medicare, and they say, well, I'm just not sure that I should look into this. I think this might be a scam or something. And I want to see what I can do to straighten you out on this. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, the first thing that you need to know about discount programs is that unless you use the right providers, if it's a drug plan, unless you go to a pharmacy that participates in the plan, if it's a dental discount plan, and some of these discount programs are kind of all rolled into one. They give you one card that's magic just about anything that you want. But you need to understand that just because you're a senior and because you're in a place where other seniors are shopping or getting their prescriptions filled or their teeth ground down or whatever it is that you're looking to do, it doesn't necessarily mean that that card's going to work there. So that's the first thing that you need to know. If you decide to use these things, and some of them are worthwhile and some of them have questionable value, let's put it like that. I've even seen some cards where, well, we do take that card, but if you don't use it, I'll save you another $20 or $30 on your whatever it is that you're getting by not using the card. So it's kind of like, well, why am I carrying this in my wallet or my purse, if it's not going to do me any good? Well, that's a good question. And the answer is, if you can find a place to use it and you feel like the benefits are worth carrying this card around and flipping it around and, seeing, well, I'm a member of such and such, if it works for you, great. If it doesn't, don't worry about it. Don't sweat it. Like I said, I have clients that have been calling me recently. This is end of July 2021, and it seems like one or two of my carriers have decided to send out this new benefit, cost you nothing. And, you've got discounts on dental and discounts on drugs and I think vision care and maybe even hearing aids. But again, the catch is you have to use providers that actually accept the plan and participate in it. And even then, the discount may not be as great as you think it is. So first off, it's not a scam. It's mainly kind of bait, if you will, especially if you're looking at enrolling in a Medicare plan, either a supplement plan or even an Advantage plan. If you're looking at enrolling in one of these, you may get information from a carrier. You may have, if you're talking to an insurance agent, especially if it's one that you invited into your home. But if you're talking to an insurance agent, they may say, well, if you get this card here, we're going to give you this card along with your policy, and look at all the stuff. You can save money on this and save money on that. These things are mostly marketing ploys, and that's why a lot of them have the word senior on them, and discount, and free, and some of them even say Medicare. I saw one that's a Medicare savings card or something to that effect. And it's mostly marketing stuff is what it is, because if you see word senior, discount, and free, then they figure you're going to use that plan. And even if you don't have to pay anything for this senior discount program, even if you don't have to pay anything for it, there is some benefit to the carrier or whoever it is that's sending this thing out, because basically every time you fill a prescription, they get a kickback. It may be 25 cents, maybe 50 cents, maybe more. And that may not seem like much, but if you've got 1,000 prescriptions being filled a month, 10,000 prescriptions being filled a month, 100,000 prescriptions filled every month, that adds up to some money. And so, and again, I'm not begrudging anybody about it, but it's definitely something that involves volume. And I picked on prescription drugs because those things seem to be rampant. They're everywhere. And the other one is dental. Dental discount plans, I got news for you. Most of those are really not worth it. I have looked at dental insurance and dental discount plans for years, and I've just never found any that I would buy myself, nor would I recommend them to anyone. But if you want to go for it, hey, have fun with it. But I don't see the benefit in any of that. But again, they're out there for a reason, and there's a lot of companies that have put these packages together. And sometimes if it's an agent that's pushing a discount plan, you can bet they're going to be the one getting the 25 or 50 cents or a buck every time you use that card. And if you're okay with that, that's fine. But it really needs to be a good value to you. And don't just take it at face value. Don't just say, oh gosh, I get 25% off of this. Well, 25% off of what? I mean, is the premium or is the price inflated in order to take 25% off? Don't just assume that because you're getting a savings that you really are getting a savings. And also with some of these things, especially with hotels and restaurants and stuff like that, before you flip out your card and say, well, I'm a member, give me my discount, they may have a senior discount already. And especially if it's one of these things that you had to pay a membership fee in order to get the card to be a member of the club. A lot of places, a lot of restaurants and so forth, give senior discounts without flipping a card on the desk or on the table. So this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.